Good morning and welcome to the question and answer session on Destination 2 of Cluster 1 of Horizon Europe, Living and Working in a Health Promoting Environment. My name is Carmen Laplaza Santos and I am the Head of Unit of Health Innovations and Ecosystems in DG Research and Innovation. And I have the pleasure to be today with two colleagues who will help us address the different questions that you might ask on this destination. Let me introduce Rita Arroyo, who is the Destination 2 leader, and Rosana Damario, who is Policy Officer for International Cooperation in Health in DG Research and Innovation. So Destination 2 of Cluster 1 is the main Horizon Europe hub for environment and health research. The main objective of this destination is to fill the knowledge gaps in the understanding of the impact in our health and well-being of environmental, socioeconomic and occupational risks that have the most significant or widespread societal impacts. In 2024, projects that will be funding under Destination 2 will provide evidence in the field of environmental pollution, as actually there is only one topic which is going to be funded, a quite important topic with a budget of 60 million euros that is aiming to provide knowledge on the impact of pollution in non-communicable diseases, and pollution understood in a quite broad way because it's addressing both air, noise, light and hazardous waste-driven pollution. This topic is a two-stages topic, what means that there will be two deadlines, a first stage deadline in September, 19th September of this year, and a second deadline in April 2024. I hope that you could watch the video that was available, providing more information on the topic and expected impacts. And just to remind that this session will focus mainly on the content of the topic. There was a session earlier this morning addressing cross-cutting issues that, in case you would still have questions, I could invite to watch the recording or to send by written. So now I will just start with the questions and answer sessions, and I will invite you to push your questions through the Slido. I see that it's quite active and there are already a few questions there. So I will start with the first one, which is asking whether for this topic on air pollution, is it mandatory to consider emerging pollutants? Rita, I pass you the floor to answer.
Yes, thank you, Carmen. Good morning. Well, this call specifically mentions the need to strengthen the body of evidence in areas where enough data are not available. So there are important knowledge gaps on the causal associations between the exposure to different classes of pollutants of emergent concern and health outcomes, and thus the proposals are strongly encouraged to address this aspect, if the focus of the proposal, of course, is in the sub-area of air pollution.
Thank you. The second question is addressing the issue of vulnerable population groups and is asking whether proposals need to include these vulnerable groups. Rita, I think this question is for you.
Yeah, I can answer to this question as well. The consideration of vulnerable population groups is part of the list of outcomes that are mentioned in the topic text, and for this topic, all the expected outcomes listed should be addressed. In that sense, if it's related to the aspects that are mentioned in the specific outcomes where vulnerable populations are addressed, the proposals should indeed take this aspect into consideration.
Thank you. A new question is focusing on the requirement to form a cluster and what does this imply at proposal stage. And yes, indeed, in environment and health Usually, projects funded under the same topic will require to form cluster in order to facilitate the impact of those projects and foster synergies. It is not straightforward to think about the precise modalities of what this will mean at proposal stage, because obviously you don't know which other proposals would be retained. So this is something that is more precise after, during the grant agreement preparation phase. However, it is useful to already think at the time you are preparing the proposal what kind of activities would make sense to collaborate on, also to be able to already foresee a certain reasonable budget. Maybe it would be helpful for you to look at the Environment and Health webpage, where there are some examples of on what kind of activities the current clusters do collaborate, and that might help you to prepare around this during the proposal preparation. But in any case, the formalities, modalities, and more concrete steps will happen at the gap preparation phase. Next question is addressing the Joint Research Center involvement, and is asking whether their involvement how needs to be addressed in the proposal. Rita?
Yeah, I can answer to this question. No, the answer is no. The potential involvement of JRC is to be discussed, and the modalities of this involvement defined after the proposals are approved. So it is important that you keep in mind that the involvement is not expected at the proposal stage. So we don't need to mention JRC in your proposal.
Thank you. Next question is asking whether proposals should present a plan on how to submit the data in the IPChem in terms of format and categories of data to be collected. Rita, could you answer?
This is related also. Yeah, this is related also with the JRC involvement, because IPChem is the information platform for chemical monitoring that is managed by the JRC, the Joint Research Center of the European Commission. So the answer is similar to the previous one. At the proposal stage, the applicants do not need to present details of how and when the submission of data to IPChem will occur. This will be discussed after the proposal is approved. And in fact, we even encourage, if possible, that this discussion might take part in the context of the activities that are to be developed in the cluster, because this will facilitate harmonization of templates and facilitate the transference of the chemical monitoring data into IPChem. But at the proposal stage, there's no need to think about how the data will be transferred to IPChem.
Thank you. Next question is focusing around two stages evaluation, and is asking what does two stages evaluation procedure entail, and whether there is maximum number of proposals that can pass to the second stage. And actually, in principle, indeed, two stages means that in the first stage, proposers are required to submit a reduced number of pages, which will be evaluated, and then a selected number of proposals will be allowed to submit a full proposal. Usually, what we intend is to have 3 times the budget of the topic. So in this particular case, we expect that around 180 million euros of total budget proposals would pass to stage 2. There is not really a maximum, but actually, in any case, it cannot be lower than 2.5 times the budget allocated for the topic. Next question is asking whether proposals are expected to focus on more than one sub-aspect of pollution address. I guess they refer to the different types of pollution that the topic is addressing: noise, air, light, and hazardous waste. So I guess this is what is referred by sub-aspect. Rita, I think they are not specifically requested to, but you are better placed to answer.
No, they are not. So the call text specifies that the applicants should focus on at least one of the sources of pollution mentioned. So the air pollution is one, noise and light pollution the second one, and pollution from hazardous waste the third. So if relevant for the proposed research activities, of course, that proposals can address more than one of these sub-areas, but proposals can also focus only in one of the sub-areas mentioned. If the way the research question is presented is under scope and is of course relevant to the expected outcomes of the call topic. So there's no need to focus in more than one sub areas.
Thank you. I think that the next question is a bit similar. I don't know, Rita, what you think. It's asking whether the proposals can focus only on single exposure routes.
Well, is because we mentioned in the call, we mentioned the possibility to address single exposure routes or combined exposure routes, but the answer is that proposals can consider single or combined exposure routes or both. Of course, it depends on the content of the proposal. However, I would advise that in case of expected limitations related to the approach chosen, the applicants should explain the reasons behind this choice, but the different combination of exposures can be considered.
Yeah, actually there are different questions around that because I see there is other question, should all the exposure routes mentioned in the text be considered? And then another question or another comment saying at least one means that it is really enough to cover one aspect, or is it better to touch somehow the other aspect as well? I guess there is a lot of interest around knowing whether by covering only one proposal is going to be somehow penalized.
Yeah, there are different aspects mentioned in the call that are related to this choice of covering exposure routes and covering the different subtopics. So this question about the exposure routes, I think, is related to the fact that we mentioned different exposure routes in the call. So we mentioned the digestive, inhalation, and dermal exposure, but although the call mentions all these exposure routes, the research activities should cover the needed exposure routes to answer to the research question that is being explored in the proposal. There is no need to cover all the exposure routes mentioned in the call text if it's not relevant to the outcomes of the proposal. So it's up to the applicants to decide which exposure routes are relevant to include. The second question, I think, is again related to the different subtopics that are considered in the call, and the answer was already given. So there's no need to focus in air pollution, noise pollution, and light pollution, or the combination with hazardous waste. The proposals can be focused in only one of these sub areas.
Indeed. So
and also considering hazardous waste, we give several examples. We talk about pharmaceuticals, exposure to microplastics, e-waste. So again, these are examples of potential sources of exposure that can be considered. Not all of them need to be considered in the same proposal.
Indeed. So actually, proposals, everything depends on what you are going to study and research about, and then the exposure route will be the one more relevant to the subtopic also that you are studying. So I think that there is no, by addressing everything, having more success, or everything will depend on having a very consistent, coherent proposal that it's addressing as good as possible the element or the subtopic that is studied. I see now a question on whether the development of sensors under this whether the development of sensors could be under the scope of the call. Yeah, for you, Rita.
Sorry, my mic was not on. Well, if relevant to the proposed research and duly justified, the development of new sensors can be part of the proposal. For example, if the available solutions do not respond to the needs of the research plan, or if there are aspects that need to be further explored, even if building on existing solutions that are already available. So it's possible this is in scope of the proposal.
And now I see a last question for the time being. It's been a very active panel, so I really thank all of you for asking so many questions. But it is a question on international, Rosanna. How many US partners are allowed to participate?
Thank you, Carmen. Well, there are no limitations in the sense that the number of participants, including US participants, depends really on the role that each participant has in the proposal. Therefore, it is a matter of what each of the single participants would bring in terms of content, in terms of expected impact, etc. So there are no limitations. It depends on the consortium, on the coordinator, how he or she plans to organize the consortium. Thank you.
Thank you, Rosanna. Oh, a new question has arrived about air pollution. How much of indoor versus outdoor pollution is considered, Rita? Difficult question.
Well, that is not mentioned in the call. So by air pollution, we include all sources of air pollution or all environments. So it can be indoor or outdoor. Several of the references that we make in the call maybe are more directed to outdoor air pollution, but indoor air pollution can also be considered.
Thank you. So no more questions for the time being. I don't know if a last one will appear. Nevertheless, yes, another question on international. Any legal entity established in the United States of America is eligible to receive union funding. Which type of partnership is the Commission expecting?
Well, we expect really any type of participant, any legal entity means it could be a university, a research organization. So I don't know if Rita has something on the content, but in terms of type of organization for the partnership, it can really be as it is written, any legal entity, no definition, nothing about it.
I don't think, Rita, that there is any specific, yeah. Okay, so thank you, Rosanna. Now I think really that was the last question. I don't think anything else is coming up. Unless any of you want to say anything further, Rita or Rosanna? Otherwise, the only thing I can still do is to thank our audience for having been so active and to wish you a lot of success, when preparing the proposals. Thanks a lot.